Some patients experience anxiety or paranoia when they use medical cannabis. For some people, just the consideration of using cannabis can make them anxious because of what they've heard about it in the past. Now, a lot of these things can be overcome, but let's talk about it. Hey everybody, it's Dr. David, board certified pediatrician, medical cannabis expert here in Tampa, Florida. I do a lot of med management. A lot of people can have some side effects to cannabis or it doesn't work properly or best for them. And an experienced provider can certainly do what I refer to as med management to be able to to tinker with doses, approaches, combinations, etc. that can get a person going in the right direction, potentially decreasing side effects, but of course, optimizing the benefit for why they're using medical cannabis in the first place. Now, in terms of anxiety, and you may have seen the video that I recently recorded about how medical cannabis can treat anxiety, but there are some people out there that the use of medical cannabis, especially of THC, can cause anxiety or in particular paranoia. Okay. Now, in addition to that, especially with the THC, some people can even get them palpitations, sometimes physiologically from using the THC, but also obviously if you're having an anxiety attack, a paranoid attack, a panic attack, you can of course get a fast heart rate from that because your heart's racing is part of that. Now, in particular, a lot of people, and what's reported in the literature is specifically paranoia. That's kind of a specific type of anxiety where a person, they're not just feeling anxious, but there's a specific concern that somebody's watching them, that somebody's tracking them, that somebody's there to cause harm to them. And that really is what the difference of paranoia is. But that's a common thing. That's something I've certainly had. I've had friends have problems with that in the past too. So it's a real deal thing. But in my opinion, it is something that can be overcome or avoided in the first place when it's done properly. Okay. Now, in terms of that, I think that the biggest mistake that people make when they're using cannabis is that they use way too much. Okay. Because, especially, and this is one of the big problems with products on the street. Number one, it could be laced with something, which would be terrible. Number two, you have no idea what you're actually taking for the most part in terms of how strong it is. There's cannabis products that may have 15% THC that may have 30% THC. And of course, the higher the percent THC, the more, if you're inhaling it, especially, you can have twice the amount of THC just from inhaling one product versus the other. Now, typically when there are tinctures done by dispensaries, that's very different because you know exactly how many milligrams, and you can get to very, very small milligram doses of that. So again, one of the major advantages of using medical cannabis as opposed to just something off of the street is that you can really titrate and get the dosing right. And of course, another issue, some people could have problems with one strain or one product, but not another. And of course, one of the issues with street products is that you have no idea what you're getting. You have unlikely that you're going to get the exact same strain each time that you purchase it. And again, with medical cannabis, if you know that you like this strain done in this route of administration, you should be able to get the same thing over and over, which should be very helpful when a person is trying to treat themselves medically, but also trying to avoid side effects. Now, so of course, starting with a very low dose, especially of THC, 1 milligram, 2 milligrams, if there's any concern, even if there is an experienced user, I say, don't start with more than 5 milligrams. Go from there if you don't know what will be, and work up. As you gradually work up the dose, if you're seeing a side effect that you don't like, of course, lower the dose or stop it. That's one of the very nice things about medical cannabis. If you have a negative effect, even if you took too much or whatever, you wake up the next day and it's kind of like a reset button. So, that's why it's okay to kind of push it. But obviously, if it's making a person feel paranoid or anxious, they're not going to want to keep doing it. So that's why I would prefer not to give them a negative reaction when they are introducing it in the first place. They kind of have, I do see some, yeah, that was too much for me. Now, other cannabinoids besides THC can cause this. I do have a couple patients who any form of cannabinoid has caused a problem. Happened to a friend of mine. I felt horrible because I'm like, don't worry, I'll figure this out. Don't worry, I'll figure this out. I think there's been 2 patients in 8 years that I have not been able to figure out. Yeah, unfortunately, of course, it happened to a friend. But this is a real thing, and of course, we want to, of course, eventually we had to abandon for her. Now, why might it be that a person gets these types of symptoms? Now, cannabinoids themselves, they overstimulate the amygdala, which is part of the brain. It's part of what's called the limbic system, okay? And this is a neural network. There's different parts of the brain that controls emotions. It controls behaviors. It can also control memory formation. So, when a person, they may be afraid to do something again because the memory was formed because they had a negative reaction to it. And because of that, though, it can make a person feel fearful. It can make a person feel anxious. Now, THC is the strongest plant-derived cannabinoid, not synthetic. So, there are the ones that are out there, but that's going to come naturally from the plant. That would be just extracted. THC is the strongest cannabinoid. So, of course, if that's what's stimulating the limbic system, the amygdala, a milligram of THC is going to stimulate that system more so than CBD, CBG, some of the other things that I like to talk about when using medical cannabis for anxiety. And as I mentioned in another video, CBD itself does seem to help more for treating anxiety than THC does, especially unless THC is done at very low doses. So, it's something to take into consideration. Of course, most people, when they come to me in the medical cannabis clinic, I need THC for my anxiety, of which I say, okay, or maybe you don't. If you really want to take this from a scientific medical perspective, do not start the THC first. Start CBD first. Maybe move into CBG, then move into THC. Of course, a patient can choose whatever they choose to do, but that's my medical advice to anybody who's getting started who really wants to make a difference. Now, it's interesting because in addition to having the anxiety symptoms, there are people who may even get anxious just from the thought of taking cannabis. Why? Because of what they've heard in society, maybe what they've heard growing up from a parent, a clergy person, because there is a lot of misinformation out there. Now, of course, if a person lives where it's legal or they're not getting it legally, that can induce anxiety because you're breaking the law. Right? And some people may be perfectly fine with breaking the law. Other people may feel guilty about breaking the law or not comfortable or not wanting to try it. So just the thought of it could potentially bring up anxious feelings. Of course, if you're in a state where it's completely legal and you qualify, get certified, that in and of itself may help a person's anxiety go down because of the fact, hey, I know I'm not breaking the law. I know I'm not going to get in trouble with this. Now, of course, people are taught not to smoke anything. Right? I'm one who believes you shouldn't smoke anything. I don't think that burning cannabis is the way to go. If you need to inhale it, I'd rather dry herb vape it or using other types of clean vaporized products. But also, of course, especially if you're somebody who hasn't smoked anything before, you can have anxiety because you think it's probably going to make you cough. And very possibly, the first time you take it, it will. Now, an experienced user doesn't typically cough. But the first time you're doing it, of course, if you are going to cough up a lung, you may get anxious because you've heard someone do it, does it, or because it made you happen that you start coughing that you don't want to do it anymore, right? Because you had that. And so, one of the things, especially when inhaling, when I'm telling somebody how to do it, is I typically will tell them, let's say, for instance, that this is a vape pen, it's just a regular pen. But if you suck on it like a straw with a complete seal, everything that you're getting in is cannabis. Whereas if you take a breath more like this, so you see how there's air coming in and the air dilutes it, you won't get as strong of a dose, which is really good when you're first starting out. Now, if you are inhaling it, just take one inhalation, put it down, and that's it. See where you are. If you're a treatment-naive patient, that may be all you need. But again, we don't want you taking 2, 3, 4, 7, and then you are wasted, and then that's not good. You want to see how it's going to make you work. That could make you, feel anxious or paranoid if you've never done it before. Now, of course, there are other forms that people can be using of it, such as, again, as I mentioned, the vaping versions. But of course, there's tinctures, there's patches, there are gummies, edibles, etc. That doesn't involve smoking. So if the concept of inhaling something makes a person anxious, there are those other ways. Okay. Now, if a person is having a panic attack or is having an anxiety attack, and once they're an experienced user, they often find that inhaling by far is the fastest way to get the benefit because it's going to work within a couple minutes. Whereas most oral products are going to take on average an hour, 30 to 90 minutes, sometimes even longer to kick in. And if you're in the middle of an attack, you want to be fixed right away. So that is where an inhale can be very helpful. Now, again, also, if you've people have had problems with it, you may get anxious as well. But overall, in my opinion, this can be avoided also because especially, and the reason why I encourage people strongly, not starting with THC, but start with CBD, CBG, etc. CBD lowers the intoxicating, anxiety-provoking effects of THC. So besides starting CBD, maybe if you're really wanting to treat your anxiety or your panic or your whatever, start the CBD first. Bring it in, then bring the THC in while the CBD is still going. You may find very much that you tolerate the THC a lot better that way. So anyways, maybe you learned a thing. Of course, if you have any questions, comments, or whatever, please share with us down below. And of course, please subscribe to this channel and share it with others so we can share this information with as many people as possible. Have a great day.